endometriosis isn't technically a autoimmune disorder. However, there is a strong agreement in the science community that it does look and behave very much like an autoimmune disorder. So we see presentations of fatigue, low immunity, of gut health imbalance, diarrhea, constipation. Very common is IBS and SIBO, leaky gut. So in a way, yes, it's helpful to have the diagnosis. It's helpful in a way that a patient's like, I've been to my gynae, I've had the laparoscopy, I've got the diagnosis, I've had the da. But it's not essential. What I'm looking at is that person. You know, we're preaching to the converted perhaps a little bit. Well, we're talking whole person. We're looking at beyond their symptoms. I'm really interested in reducing symptoms and increasing quality of life, of course, right? So these are really primary outcomes. We want to help them live a happier life, and if they can be in less pain and feel happier and more calm, sleep better, and digestion is working, it's like top. That's primary. But really what we're looking at is the constitutional type and using the right and choosing the right herbs to support their constitutional type. So I get asked so many times, but what is the best herb for X? And it's such a hard one to answer, because I know we want reductionist quick answers. And yes, there are particular herbs that I would go to in the dispensary that I know would be effective for, say, heavy bleeding, for example. I'd use my astringent, really supportive, toning cardiovascular herbs. So yarrow is a real go-to for me for heavy bleeding, maybe shepherd's purse when there's really acute flooding and menorrhagia. But, you know, depending on that person's constitutional type, it might be